nonsensical people just trying to take the other side of the argument. On a very positive note, I really want to think that these people are fighting this just because they love to fight something. It's just fight.
Hey there. Welcome to the Gluten Free Organic Thoughts podcast, where you are encouraged to express your natural thoughts and views through casual, meaningful conversations that hopefully can lead to learning and understanding new perspectives. To find out more info, visit www.gfothoughts.com. Now, here are your hosts, Michael Wong and Robert Din. We hope you enjoy this episode.
Hello, fellow new listeners, and welcome back, fellow loyal listeners. This is Michael, your co-host for the Gluten Free Organic Thought podcast, and today's episode is very COVID related. So we're gonna have a good friend of mine from college joining us, who is Alejo, and he's been definitely active on keeping that, tabs with the COVID data. He even built a watch list for people to actually subscribe to that. He'll be sharing us his experiences and throughout, his whole journey trying to escape COVID, to be honest. But always hosted with me, Robert Din.
Hey guys, this is Robert. Happy to have Luis on. It's gonna be interesting. He's been traveling around and he'll be able to give us some good insight on stuff. First of all, what we want to do is we want to see what everyone's drinking. Mike, you want to start?
I'm doing, to be honest, it's 5 p.m. here in California time, so coffee still.
5 p.m. That means wine time for me.
There we go.
And I'm drinking the little coffee that is called coffee on a tea or something that they give me here at the hotel. So
can you show that again?
Show that again. Yeah.
Right here, it's like.
So for those people who can't see, it says Arabican coffee, tea bag coffee. So it's a tea bag coffee. Is that what it is?
Yeah, it is. It has instructions here
of how to make it.
It's just pretty much steam the tea. You just
It's like tea. I did like tea, but it's made of coffee. So it's like coffee. Never had it.
That's pretty smart. It's kind of like almost like a K-cup in a sense, but they just leave it in the in the water for longer. It would make it stronger.
Yeah. I think so because it's very soft, so it really doesn't feel like coffee. It's not. It doesn't get black. It gets like brown.
It looks like tea. It's like tea-ish.
Tea.
It's brown tea-ish.
Coffee tea.
Yeah, mine is like this. So my wine is like this Portuguese wine.
Nice.
Is that Pinot? No, it's a Cab.
Is this yours, Luis? Like.
Yeah, I was gonna say my primo. Yeah.
Alrighty, so Luis, tell us about your experiences in New York, man.
So
for those who are not listening, tell us a little bit more about yourself.
Yeah. So let me start. So I lived. I don't live anywhere right now, but I used to live in New York for 10 years. I moved in 2010. I've been working there as an engineer. And when COVID started, I kind of saw it. I wish I would have spent more time sitting down and meditating what was really going to happen, but I was like, this is going to be a big deal. I know this is going to ruin our lives, whatever. So I was lucky that our lease was ending at the end of April. So I basically said, I'm not renewing. I'm sorry, I'm out. I'm not going to stay in New York. And things in New York are really...
You got rid of the apartment, the nice penthouse apartment?
Yeah, well, I didn't. All of my roommates are still there. So
okay, all right.
You were living in a penthouse?
Yeah.
Wow.
So, little side step here. So there is a hack, right, in New York City, which is, you probably, you guys are in the Bay Area, so you know all about this. Real estate is really expensive, right? Mm-hmm. It's like really, really bad. So in New York, think of you're paying amount of dollars per square feet. Whenever you're in a studio, you're paying pretty prime, like good money for that. Mm-hmm. One bedroom apartment is the most expensive one, right? Mm-hmm. Two bedroom apartment, it goes down a little bit, not much. Three bedroom apartment, it goes up a little bit again. But then 4, 5, 6, the price just plummets because of inventory, because people don't really organize and do this. So what I've been doing in 2 different places now, I just got together a bunch of roommates and we rented these full townhouse ones and then this penthouse the second time. And the irony is that each one of us paid less than if we will have our own,
right?
Yeah.
So a studio, not even 1 bedroom, like cheap. So you save money, you have fun with your friends. It's good. The only problem is you get older. So
Yeah.
Yeah,
Sure.
and you're living with 6 people, so like, it's
Right,
can
right.
get crazy.
Yeah, you always think that's a big thing, but like since the places are so massive, and to be fair, they have never been random people. It has been my friends, so
Yeah,
it has been a pretty positive experience. But again, you get older, so things
yeah,
happen, and there is a pandemic. So,
yeah.
but getting back on topic,
Yeah.
so I decided to leave New York, but before leaving New York, I kept checking the numbers. I was like, no, this is going to be bad. This is going to be bad. No, Italy had it. This is it. Now we're really screwed. And to the point that it wasn't healthy, right? Like, I was just like watching these numbers every hour, refreshing. And I said, no, I'm not going to do this anymore. So what I did is I wrote this program that basically web crawls the website I was reading the numbers from. And it basically starts saving all the numbers, diffing with the previous scroll, etc. And then at the time it was every 4 hours, it will send me a very nice formatted email with all of the current numbers per country. And I kind of rank the countries. So, we always think about like how many cases here or there, but what I did is I recorded the rankings so that when a country got a lot of cases, it will go up the rankings. So in the email, it will look a little bit like sports, which kind of sucks, but countries will go up 3 spots. And we literally watch United States go from the back to the front.
Hey, we gotta be number one, man. We have to be number one.
We're killing it. We're killing it.
Literally. Literally. Pretty often. So anyway, so I created the watch, and it was pretty great because I stopped watching. It will get the email, and that's all I check. If I was curious about a country, you can still have it and click on a link. And with time, I lowered the emails to every 8 hours. So now I just check 3 times a day, which I think is okay.
So that's stressful.
I don't worry about it. But anyway, so I grabbed a car and then I drove to Houston. And in late May, right? And I was really happy about it. I was like, okay, I got out of New York.
Wait, so pause for a second. When was like New York was spiking? What, like
March, right? Early March.
Was that March?
Yeah.
Yeah. Hang on. When did shutdown happen? What shutdown happened in mid-March, right?
Yes. So the shutdown happened a little bit after Super Tuesday, which was March 3rd. And then everything went back. Everybody started working from home, etc. The whole shebang. Yeah, I'm looking at here, late March. Okay, so in March 12th, New York had 328 cases. By the end of March, we had 76,000 cases, which ironically is everything that the U.S. reports in one day today.
Yeah.
Right?
Yeah.
Anyways, so by the time that we were in April, it was already like in May, we already had a lot of cases. The curve was, flattening. But I went to Houston and I escaped from it, right? So I went from total lockdown to going back to the gym, like on day one. I was like, oh my God, this is like another country. Like, what the hell? I got here and everything is open. I was the only one wearing a mask. I was like, what's going on? Then I stayed in Houston for about 5 weeks. My girlfriend came and to visit me. And then we drove then the cases really got serious. I was like, okay, Houston, I'm not doing this again. Bye. Peace. And then I went to New Orleans. We went to New Orleans together. We stayed there for a week. It was really nice. Again, we went out, like walking at night and etc. And to a point, like up to like 11 p.m., everything felt very safe. And I don't know if you've been to New Orleans, but things get pretty rowdy. Night. So after 11, you start seeing all the people come out, and
they were still going partying
in New Orleans.
In New Orleans?
Oh yeah.
They don't care either.
Remember, it's spring break at that time. Remember that it's spring break at that time for a lot of people. I don't care
if it's spring break or not. Like,
well, keep in mind, young people didn't care at that time though. Late March at airports, all college break.
I mean, here's the thing that I don't think we appreciate enough, which is people listen to the governments, right? And the reality is, if your government tells you it's fine, you can go to the bar, they're all open, people are going to do it. Because there is this sense of following the law. Like we're, at least in the States, we're not very educated to be rebels and break the law. Because the consequences are dire. But whenever there are recommendations, or like in Louisiana at the time, the governor, or in Texas, the governor didn't even said that it was mandatory to wear a mask.
Yeah.
So,
Recommendation.
right. So the party was rowdy, and then at around 11, we're like, we're going back, whatever. Yeah. So then after that, we drove to Atlanta.
Wait, how long did you stay in New Orleans?
1 week.
1 week.
One
That's
week.
probably longer than I would have stayed.
Yeah.
Like seeing all that stuff happen at night, I would have just been like, all right, we'll stay a couple days and then we gotta go.
Yeah. And then in Atlanta, we stayed maybe 5 days, and then she came to Korea, and I went to Miami to be with my mom. I was like, okay, I made it. It's going to be safe. We're good.
Mhm.
In a matter of like 10, 15 days, Miami became the new world hotspot. Worse than Wuhan, right? So I was
Yeah.
like, God, like this is happening again. And in Miami, it was particularly scary for me because I went to my mom's house. So it's all fun and games until you think of infecting your mom, right?
Yeah.
Sure, my mom has been extremely careful, but like if she gets it, and we have to deal with it.
Yeah.
But if I gave it to her, I couldn't like forgive myself ever.
Right.
You feel more guilty
I
for sure.
agree.
Yeah.
Right. So I was like, no, mom, I'm not staying here longer because it's too much stress. Like literally, I'm not a person that gets stressed, but I felt the stress.
Yeah.
So like, I'm done. I'm going to Korea.
Yeah, I
so
felt
then
that same way because I was gonna go to Orlando and stay with my family for coronavirus when this all started, but I was like, we didn't know how long it was gonna last, and the company that I was working for was like doing a 2 week at a time thing where they're like, oh, we're staying home another couple of weeks. So I was like, all right, well, if I go back to Orlando, I would want to quarantine myself. Even though I know I'm okay, like I haven't been seeing anyone, I would still want to like after the airport quarantine myself before I see her, and then I don't know how long it would be until I come back. So I was like, it was like thinking about giving it to someone in your family. It seems like
Yeah. It's a whole different.
it's really top of mind.
Yeah.
Yeah, it's a different ballgame. So exactly.
Yeah.
Exactly.
It's the same thing for me though. Before, I mean, I was traveling to Vegas every week until literally the week before the shutdown. And then I'm like, okay, you know what? It doesn't make sense for me to be in LA when this happened because the whole city's going to shut down. And not only that, I'm in an area where I don't have a car. And, so for me, you know what? I'm going to get out of here because also it's a very dense population area. So I'm just going to go to Orlando, just camp out there until things settles. So I went back to Orlando, and then I figured, you know what? If I'm going to visit my parents, at least I can quarantine myself there for 3 to 4 weeks and just drive down. And so I actually did that. I quarantined myself for 4 weeks, and then I drove down to my parents. And then actually my parents were going out during April time every single day looking for excuses to go to Whole Foods just because they couldn't be sit still. Like,
Yeah, it's rough.
well, they were, I mean, keep in mind, they were tired, obviously, but they were being safe, but they just couldn't stay in the house all the time. Like, nah, you guys sit your ass down. You're going to stay here. So I stayed with them for like 2.5 months, to be honest. But that back in my head in the sense that, okay, so I had to stay put here myself because I don't want to infect them either, though. So.
Right.
Yeah.
Right. Exactly. So yeah. So last weekend, I took a plane, Miami, Detroit, Seoul, Delta, and then I arrived here, and it was just like, obviously the Miami, Detroit, nothing. They didn't check anything. Well, not wear a mask, and they wouldn't care.
Yeah.
To board the plane, they checked my temperature, which I was like, that's nice, I guess.
Nice.
Yeah.
And then that's it. I boarded the plane, and 14 hours, I landed in Seoul. When I landed here, I got off the plane, and every single person on the tarmac and like at the, whatever, international arrivals had like a hazmat suit.
Oh my God.
Full goggle on, hazmat with signs. And like my first feeling was like, we are in a pandemic. Like,
so you actually felt that experience.
Yeah.
Oh shit.
Like this is serious. People are dying. Wow.
Yeah.
But then I was like, maybe it makes you feel like the place where you are at is like people dying on the street. But the reality is Korea is on the cusp of beating this virus and beating this pandemic, and they never closed.
They never closed. Together, Mike. They never closed though.
Never closed.
People don't understand that. Like they never closed.
Well, yes, I appreciate that, right? Because you compare it to the country. But here's the thing, like, look at all the precautions that they're taking, right? Like everybody, like hazmat suit. Like, you know how many hazmat suits I saw in the States? 0. 5 states, 0. I didn't go to the hospital, to be fair, but pretty bad, right? So I got there. The first thing you do is they take your temperature. Now you have to download an app first. Then they take your temperature, and unfortunately, it was a little high.
Oh, really?
Yeah, it was like 100.2 or 0.02.
So you get pulled to the next special line.
Yeah, I did, and I'm sure it was because at the plane I was just hitting that champagne. So, anyways.
Just drinking. Wait. Were you flying first class at least going there?
Yeah.
Okay, you were drinking for sure.
Real nice. Yeah, but I went to sleep, and I literally, when I woke up, because I went to sleep and then we landed, I was a little hungover. So I was like, boom, high temperature. I don't know the correlation. I'm very curious about that. I need to do some experiments. But anyways, they put me out of the line into a line that said symptoms, and I was like, fuck. So I went into the line. Yeah, it was serious, right?
But even if you didn't have symptoms, if people in the line, they might have symptoms, you might get it.
So
think about it.
So you go into the symptoms line, and they sit you in a cubicle, basically like a big space by yourself. They take your passport, the whole thing. They give you an N95. They take off your mask, throw it away, give you a new one, and then 10 minutes later, they're like, "Follow me." You go out into like the tarmac, like you go down an elevator, and then you're like in the middle of the airport, and then they give you a COVID test, like open air. So that
outside.
My nose,
outside. Yeah,
outside. Through my nose, on my mouth, like in my mouth, and that's it. Okay, go back. So then they say, okay, perfect, follow us. You have like a guy that like comes with you the whole time, like with the hazmat suit, and it's like your guide. Follow me here, blah, 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 blah. Finally, I passed immigration. I get my bags. There is a boss waiting for me and 2 more people. I guess they had symptoms too. Oh yeah, they had symptoms too. And they were like, high temperature. And then this giant boss, really fancy boss, picks us up and he takes us to the airport hotel. We get to the airport hotel, and the entire hotel is like COVID. It's like, imagine like plastic all over the floor and the walls.
Mm-hmm.
And it's like, what
so pretty much Asian style. Cover everything.
It's like going into an Asian house where they're covering up everything.
The couches is.
I don't know that. Yeah, I'm not familiar with that. But yes, everything is covered in plastic, and you're like, this is surreal. And then everybody has it. Those hazmat suits have to be like so like abundant because everybody has them. So then they give you dinner, and they're like, you're gonna wait here for your results. If your results are positive, you're going.
So wait, how many hours have gone by since you took the test and you landed? You got to the airport already. How many hours have gone by? 2 hours?
2 hours and a half, bro.
Okay, it's not too bad. Okay.
It's not too bad because I got to the hotel like at 7:30 and I landed like at 4:30. So while we walk, 2-3 hours.
Mm-hmm.
About that. So anyway, so I got not bad at all. Like the efficiency, it's so upsetting how good they are at everything.
Yeah.
It's like I feel shocked, amazed, and sad. So
all 3 feelings together.
All of them, it goes like, wow. Like we're so behind in our continent, and it like drives me nuts. Anyway, so I got to the hotel. And they're like, okay, you're gonna wait here. 6 hours later, they send the result to my girlfriend because you have to give a contact. The government is a little like serious. Like they call her and she's like, who is this Luis Becca?
She's gonna say, I know this guy.
I don't know him.
Right.
You should thank her.
She's like, well, I guess the government knows we're together. It's pretty official. Like, Korea knows. So you wait for your results there, and after your results come in, if you're positive, they send you to the hospital immediately, regardless of your symptoms. And then
so regardless of symptoms, they could have overwhelmed the hospital easily there, that means.
Yes. If you test positive, No symptoms, you go to the hospital, and you're not leaving the hospital until you test negative multiple times, right?
So they actually put you in a room even though you have no symptoms. Like,
Yeah,
wow.
yeah. Because they cure you, because they have extra capacity, because they prepare for it.
Yeah.
And because the government knows, and here's the kicker. You know how much the treatment is? Free.
Yeah, of course. The healthcare system there is all free if
Yeah.
Yeah.
Because the government says, if we don't cure the foreigners or whatever, it's going to be more expensive for our economy than just curing them. So let's just
it adds up later on. It just builds the backlog. Yeah, correct.
Yeah.
Right. Anyways, I tested negative. So that hotel was free too, by the way. And then the next morning, they're like, okay, now you have to go to another hotel. So I took a bus back to the airport. I showed my passport. They sent me to another bus. That bus took us here to in Seoul, basically. I don't want to say town. I don't know the city well, but right in the map where it said Seoul, in the middle. North of the Han River, though. So here, and then I got to this hotel, like a really nice hotel. But then when you come in, again, plastic everywhere. The whole lobby taken. Like the government booked the whole hotel. It's like 17 floors. I don't know how many rooms are here, but a lot of, like, it's a big freaking hotel, right?
Yeah.
And you come in, your passport, another COVID exam. Damn it. I don't know why. Another COVID exam. And then they said, okay, here is your keys. I have to pay for this hotel. And it includes the food and stuff. I think it's very cheap, by the way. But
what is it per night? I'm just wondering. It's
like $90 per night.
That's it?
Yeah.
With food?
Yeah, with like Korean food. Like it has been, honestly, so far, like a gastronomical experience for me. I thought I like Korean food and I knew a lot about it, but I don't know anything about it. Because like I have tried things that my mouth had never tasted before.
Wait, so like you get a full meal though, like dessert and everything?
I have one here, and we can open it if you want. And yeah, and it's more food that I can consume. So am I starting to accumulate? Because I'm really bad at throwing food away.
Yeah, I hate throwing food away too.
Yeah. So now I have to be in this room for 14 days. I'm on day 6. So there is announcements that said, we're delivering the food now. And then the food is in your door. Open the door. So you open the door. You have to wear a mask. You open the door. And there is a basket, like a basket, right? Okay. On the floor. And inside the basket, there is a bag, completely the plastic with all your food, everything individually packed. And you just grab it and go back into your room. You don't see any human.
So wait, how do you throw away your garbage? Curious.
Good question. So they gave us 15 bags of like bio, I don't know, like these orange bags.
So it's kind of like biodegradable bags. Looks like they can throw away. Looks like.
Yeah. And then they give us a spray. I have everything here. You guys want to see it? And then a spray that you have to put the bag in, and then they pick it up in the morning. So
it's kind of like a Lysol in a sense to make sure the antibacterial, it kind of kills it.
I don't know what it is. And then they said that after you do that, you have to wash your hands. So it's probably like toxic. I don't know. And then you put it out every day. If you need something else, like more coffee or whatever, you call, because there is a phone line. And they say that on the next delivery, they will deliver that. If you need more water or whatever it is, right? I'm going to call tonight to change my bed sheets because they haven't changed it. And it's starting to get like to the point. But I don't know what they're going to do. I hope they just bring me new. I don't know. We'll see.
So you had no room service, obviously. So
you don't know how room service is yet.
Okay.
No room service. And again, you do get a lot of food on this street.
But how about like laundry? Like, what if you do want to wash your clothes? Do they do it for you too?
No. Oh, I thought about it first, but I got this big blue soap. And I guess you just go to the bathroom and
wash your clothes.
Yeah.
And I was prepared. So I brought more clothes than 14 days. And what I did, I bought white T-shirts and black T-shirts.
Yeah.
And then I put 15 of them on the closet.
There you go.
Like a pair of socks. And I'm like, okay, when I get through this, I'm going to be like the closet is going to be.
Then it's time to go already.
Yeah, exactly. I haven't worn shoes since I arrived. So I've been barefoot all this time. It's weird. I've never been in this kind of solitary confinement in my life. And again, it's kind of ironic because this is the country that is already winning. And look the precautions that they're taking. And when you compare it with the States right now, where we are losing, we're number one in the world losing. we are not even close to this level of precautions, right? So it's like when you
Is it because of money, or is it because do you think it's because there's no essentially maybe leadership behind that? Because ultimately that comes down to the local, right? Because even though federal should demand it, but obviously federal is not going to do anything that. So do you think overall, like, even if we were to do it, how would that even work? Because we're so different.
We're
you know what
so
I mean?
big.
We're so
also.
big, and
I
regional
mean,
is so different.
It is because of leadership, 100%. If you look at what happened in New York is winning, right? You look at the graph in New York and you go down.
Yeah.
The problem is that New York is not a country, so they cannot close borders.
Correct.
They can.
I agree. Yeah. Also, in San Francisco is very similar, where we only have like San Francisco proper only has like 6,000 cases total or something. Like a bigger Bay Area has more, but like in San Francisco, there's only been a few thousand cases, and
you can't scrub border though.
You can't stop it because there's only so much you can do, to like stop everyone from going outside, and then people coming in, like you have to be vigilant about how
can
people
state
going
shut
in and
down
out.
and not prevent people? Because I thought didn't Florida do this? Florida prevented people from New York to fly in. I remember that.
So what you can do is you can tell them that you have to quarantine. A state cannot prevent people from another state coming in.
I could have sworn they did something with the highway, like people were driving down. They prevented, hey, you're coming from New York. They asked people what they were coming from. And I think you're right. I think they probably got the information, hey, you need to quarantine for 14 days. Where are you staying at? Things like that. I think that's what they did. Probably.
Yeah, you can do that.
But it's like, it's not mandatory quarantine. It's like you should if you want. Like I feel like that's how it is in Florida.
It's kind of like a little worse than that, because they're like, oh, we will find you. Sure. Who's gonna enforce it? Oh, I don't know. Like, it doesn't work like that. Again, the thing is that people follow governments, but if governments tell you that you're gonna get fined thousands of dollars for doing something, you won't do it. But so yeah, I think, Mike, it's 100% leadership or lack of leadership. And really unorganized plan, and just that lack of belief of science. And whenever you have leaders in different states, kind of like downplaying the risks, people are gonna grow skeptical about it. Anyways, if you look back at what we're doing in the States, in South America, it's kind of cute. It's like, that is so nice. And comparing it to what they do here, because it's like, you know what I mean, right? It's kind of like, imagine like a 5-year-old playing a soccer game and against adults, but the 5-year-old thinks he's going to win. And it's kind of cute. It's like, you never had a chance. That is, like the contact tracing program that they had here, it's incredible. Look, just this is not contact tracing, but in my phone, every day at both rush hours, the morning and the afternoon, so like, 7 a.m. and 5 p.m. I get extreme alerts. Like when we get Amber alerts in the States, or like flooding alerts.
So you get positive COVID alerts like all the time around you, just because it's
Yes, it's an extreme alert. Please wear a mask. If you're feeling symptoms, don't take public transportations. If you're feeling any symptoms, click here to like find your testing sites. To the entire nation. So if you're blasting these messages 2 times a day, you create that conscience, right? My girlfriend is that absolutely everyone wears a mask, and that apparently there is an app that you download and you take picture of people without mask in public places.
Damn, you could rat people out?
Fined.
You could rat people out?
I would love that. I would love that so much.
Oh my God. There'll be so much hate though. I mean, so is it all reporting anonymously though, at least?
Yes.
Okay, hopefully at least.
But you have to be paparazzi. So if they see you going like this, they
just pretend to be a tourist. You probably can get away with it because you're a tourist.
I wouldn't dare. They're pretty good. But anyway, so they have that, and their contact tracing program is just pretty fantastic. It's they basically track your phone. Just think of Google Timeline, but the government has this information, and then if you happen to be, let's say, in a 7-Eleven at 5 p.m., and then you have that line, right? And then somebody else that tested positive tomorrow was at that 5 p.m. in 7-Eleven, you get a message saying, when you were to 7-Eleven, there was somebody else that tested positive.
You should go get tested.
Oh, you should go
No.
test now. So
Yeah,
you
go
go
get
out of the
tested.
corner, you test
Yeah.
it, couple of hours, 6 hours, you get your result. Now it spreads like that. So contact tracing, testing, and really.
So talk about testing though. Like before we move on that part. So you were in the airport, right? And you did the test. How fast the result was? Just wondering. Like how fast did you get?
6 hours later, they called me and they said I was negative.
Oh, okay. So all the tests 6 hours later. That's pretty fast though. It takes about
That's
4
pretty
days
quick.
here.
No, that's not true. I
The-
got
the-
tested. I got tested on Friday, and
Yeah.
then I got results on Saturday.
Well, it depends though. For me, I got instant test result because I went to my primary care. But then if you do the free test, a lot of the big areas takes about 4 days.
Yeah,
No,
well,
mine was free. Mine was here. Like
Yeah.
it wasn't at a primary care. It was just here in San
See, people in
Francisco.
Florida, it took about 4 days to get it back.
So the way to think about it is the following. Look, when I drove to Houston, I stopped in Alabama to do a driving test.
Yeah.
And at the time, nothing was going on in Alabama.
Yeah.
So I literally drove into a clinic. They had like a little thing on the parking lot.
Mhm.
Nobody was there. I sat down. I talked to the guy. He gave me the test. He
Mhm.
said, wait in your car. And 35 minutes later, he gave me the results.
Okay,
So-
so there was an instant result for you then. Okay.
Yeah. So the way of thinking of this testing is you need a machine.
Mhm.
You put your stuff in. It tells you the results. But say that machine takes, let's throw a number, might be wrong, right? 20 to 30 minutes, right?
Yeah. Mhm.
If you're the only person, then guess what? 20 to 30 minutes. But if the three of us go, now I'm going to get my results in 20 minutes. You're going to get it in 40, and you're going
Yep.
to get it in an hour.
Yeah.
Right?
Assuming you have one
Plus,
machine.
you-
Yeah, correct. Mhm.
Exactly. So whenever you have 1,000 people, they collect
Yeah.
the sample. And all your samples are doing is going to the machine.
It's just backlog, pile up, backlog. Yeah.
Backlog, exactly. So that's really what's happening. So I feel that the reason the results on the airport took 6 hours instead of faster is because they're processing all of the flights coming
Yeah,
in.
a whole
Correct.
a whole
Of a whole
flight
pl-
or
yeah.
a whole group of planes. That's true.
Yeah. Well, I know probably Korea does a really good job of actually segregating those tests really well, because one of my friends actually works at the airport there, actually in Seoul right now, and she was telling me like how they very delicately handle those testing because one, they don't want to contaminate. Those are the biggest issue like United States has here. There's a lot of reports about contamination here situation, but they've done a really good job over there in Korea in terms of like handle those kind of tests, especially the public street ones. I heard that you guys have public streets over there, like doing
Yeah.
testings, random
Yeah.
people.
Yeah. We've seen it, but not in person yet. But
Yeah.
he just showed me all the pictures, and it's literally like a booth on the middle of the corner, unlike in the middle in a road, and you just walk in and you're like, two, okay, go back. It's amazing. It's amazing. I'm very impressed at what they have been able to do. And as I said, it's kind of like a double, like I look at that, I get happy, then I get mad,
Yeah.
and then I stop because we have no chance.
Yeah.
Which is, I don't know what's going to happen. But yeah, for now I'm here. Hopefully in 8 days, I'm going to be able to leave this room.
So how long you plan to stay out there, man?
So I'm going to plan to stay at least a month.
Okay.
I'm taking everything.
Not counting your 2 weeks quarantine.
Correct. Exactly. That's like a pause in time.
Yeah.
But after that, I really have to see what's going on because I want to see what's going on with the States, right?
Yeah, well, I mean, you checked your accounts every day, right? Like, do you think overall, are we overcounting or undercounting? I'm just curious. Just because you see the data, you've been seeing it from the very beginning, and like obviously the very beginning we were way behind counting, way behind testing. That seems why you saw the huge spike of testing, right? And your huge spike of positive cases, just like every other country had. And then as we slowly caught up to testing, I personally don't think we caught up with testing yet, but as we slowly catch up to testing, that count went up, right? But do you think right now today, like, do you feel we're still overcounting or undercounting? Like, when
you say overcounting, are you talking about over-testing?
No. Testing wise, in terms of correct. In terms of testing wise, do you think we tested enough that we think we have the transparency, or do you think that we still have a long way to go?
No, we're definitely not testing enough. So there are three things in that. Yeah. Obviously, my 2 cents of it. So, one, I don't think we're testing enough, right? Per capita, we're actually, I have the numbers here. The total numbers, the total amount, we have only, what is that? 17.8% tests of the population total. That means,
I look at
Wait,
Korea.
are you sure? Is that the number of tests? Because there's people that have
No.
taken like 4 or 5
multiple
tests, right?
Yeah, that's the number of tests, exactly. Yeah, million of population. No, but the point is, we're definitely not testing enough.
Yeah.
Second is we're not testing the right people.
That's the thing.
Right?
Yeah, I was going to
Yeah.
get to that. I was going to get to that
Yeah.
sentence. Like, do you think we're testing the right people now? See?
We're not testing the right, or not all of the right people, right? And then the third thing is we're taking too long for the results. So who cares if I did a COVID test on Monday and I'm going to find out on Saturday, Sunday that I was positive,
Yeah.
without tracing the 5,000 people.
You could have driven to 5 different states already by that time already, and you never get the results. Oh, I was positive.
Also, they're not doing contract tracing, so like
Yeah.
you could test positive, but then all the people you've met in the meantime aren't gonna get tested because nobody really has been contracted.
So for me, before I flew back to California, I had to make sure, at least for my own safety, for my own, I guess, mind at ease and safety of everybody else. And you know what? Let me get my test before I get on the plane, so that I know I'm negative. So because the primary care that I went to, the test result was 20 minutes. And so I got that. I found out, I was negative. And then so I got on the plane. Otherwise, if I was positive, I would never flew in the plane, right? So at least doing that due diligence, I think, as an individual, I think you owe it to yourself and the people, though. I personally think that's, the way to do that. So
Yeah, I did the test. The second test that I took was in Miami, and it was the week before flying here.
how long did that take you to get your results? Just wondering.
7 days.
7 days?
7 days? Whew.
Yeah. See?
So it was like
That's too long.
Yeah. So going back to like what data you get right now, like say the counts, the data you on the watch list. How far do you think this data is? Like how behind do you think this is?
from what it hypothetically really is.
Yeah, because I feel like this data is 5 to 6 days behind easily. I personally think so. Even the death count, right? The death count, they already said that this on the website, the death count even says.
So let's talk about the official numbers, right? Like,
yeah.
Let's say that you're positive in, let's pick a random state here, in a state that is small, here. Vermont, right? Vermont reported 7 cases today, right? When we think about it, we're talking about 7 people that they called and they were like, you're positive, right?
Yeah.
Well, let's start by the fact that those people probably didn't take the test today.
Yeah.
Right?
Exactly.
They took the test in the past.
Yeah.
So what these numbers are really saying is today we have been able to process a number of tests that
Correct.
7 of those are positive, right?
Yep.
So when you go to metro areas, really you're talking about maybe a week behind, right?
Yeah, because more population is more dense. You just got to deal with that.
There are less machines to process the test. Now, that's only for like the diagnostics. Now, the deaths, every state has different rules. Every state has you have to do an autopsy and figure it out.
Correct.
And some other states have other rules, etc. So when you actually overlay the graphs of the cases and the deaths, there is a significant delay of the deaths to the cases. So you have like the cases rising and then you have the deaths kind of like that.
But people don't know about that though. People don't see, the media doesn't even say that. I'm sorry. Like I feel like the lack of transparency, it's kind of because of lack of transparency, people start not believing the data as much though, if you think about it.
But like how can you no, but like isn't that like an obvious thing that like, oh, you're gonna get it, like if you die from COVID, you're gonna get tested before that as a reason, right? So like there's gonna be a time when you have COVID and then you die, right? Yeah. So it seems like an obvious like delay.
I mean, I don't know.
Is it obvious though, to be honest?
No,
it seems obvious. Like you could, like you don't get COVID and then die right away. Like that's not like, oh, I got tested, I got positive, and now I'm dead. Like that's not how it really works.
But I think just in terms of like capturing the death correctly, right? For example, like even CDC said it may take up to 7 to 10 days just to get the right death certification for that, right? And that's one of the things is that people don't understand that part of it, because right now the death, for example, Florida today reported 217 deaths. This data is published from 7 days ago.
I mean, here's the thing, Mike.
Yeah.
Good luck explaining that to the American people when we're still trying to make them wear a mask.
Yeah.
Yeah.
Like our first goal is to wear a fucking mask. That's all we're trying for people to do. And you still have these nonsensical people just trying to take the other side of the argument. Maybe I look, on a very positive note, I really want to think that these people are fighting this just because they love to fight something. They just fight.
I mean, people get the time in their hand now, to be honest, too. You think about it, right? People has a lot of spare time because they have nothing to do. They're quarantined.
Yeah. I want to fight about something, right? So yes, I think that explaining the methodology for these numbers and how it works, it's very hard for people to see. But I mean, the reality of the matter is that today, whatever methodology they use, again, 1,000 deaths in the States, and this is crazy. I think our 7-day average is now over 1,000. Let's check.
Roughly around that, I think.
So what is the so like Korea is doing a great job of like testing and doing all that stuff. Like, what is their percentage of population tested versus where we are?
Yeah. And also, one of the things I do want to address with Korea, like obviously they never shut down, and everybody there that, took the precautions, like obviously the disease didn't spread as much, but the question is though, would it ever go away though, right? Like, I mean, you prevent it from spreading, but doesn't mean necessarily just disappear, right?
Oh, no, I think the world as a planet, we lost this war months ago. I mean, the flu that we get comes from the 1918 pandemic. We never won that. Yeah. We already lost this one. Yeah. And we lost it way back.
Yeah.
The moment it entered the United States, we lost it.
Well, I mean,
I assume like this is gonna be just like a flu. We're gonna have like a flu vaccine and a corona vaccine like every year. That's what's gonna happen.
To be honest, though, I mean, Luis, for me, what pissed me off was the WHO, man. To be honest, when they had a chance to go to announce that whole situation in January, man, they said that this is not spreadable. In that tweet, remember? So I actually there's an image that I sent. Actually, check your email, Robert. There's an email, the image of the tweet. They announced that this was not spreadable, like in a sense, like, hang on, let me pull that up and I'll send you guys the link.
I mean, check the date. When did they say that?
It was January something, like late
Okay,
January.
now check the next one where they said, oh shit, we made a mistake. It is
a week later. Yeah, that's what I'm saying. A week later. Yeah. Like, how do you announce something like that so
it's science. Science learns. Like, look, the big thing about science is that it's literally a scientific method. You learn by error. Yeah. Now, it is upsetting. It's very upsetting and very sobering. Yep. The fact that our human technology, it's so advanced to do video conferences, but so behind. We cannot process vaccines, and like we're really behind in technology when it comes to bioscience.
Well, in healthcare in general, to be honest, I completely agree in that part.
Yeah. The healthcare industry, and known being behind on everything. So shame on all my engineer peers working on that area. What the hell are you doing?
Yeah. Well, also, I mean, I'm not upset about the fact that that happened. I'm more upset about how people reacted to that, and because especially our leadership, right, in terms of this is nothing. Look what the WHO said. This, and then a week later, oh shit, this is actually real. And we need to stop. Okay, so my parents were in China, I think, until end of January. And I told them, oh crap, once they announced that they're going to shut the flights back down, only allow U.S. citizens back. And my parents like, listen, guys, you got to change your flight. I don't care where you guys fly out of. So I really rerouted my parents' flight from Hong Kong back to L.A. Literally, I think the second week of February before they literally cut all the flights out. So my parents got back to L.A. literally on the second week of February. Then Delta announced, hey, we're not doing all these direct flights coming up after the third week of February, cancel. So literally I got lucky getting them back, to be honest. But the fact that though, it's just in general, like the reaction, because this type of thing, I don't think they could afford to make a mistake, make an announcement like this, because people get skeptical. And once that happens, it loses its credibility. So to be honest, though, before the pandemic and now, looks like during the pandemic, I see a lot of people losing faith in those organizations.
They've done other things too. There was once, I think it was like the head of the CDC or maybe it was the WHO, but they said something like people who are asymptomatic don't spread.
Yeah,
something like that.
And there was a tweet about that too.
Yeah, and like they said it in a conference, but what they meant by asymptomatic is people that have it but will never show symptoms. But then people that are pre-symptomatic, they can spread it. So like just the wording that they used made people like, and then they said it and it gets spread everywhere, and then now people won't see the redaction. Like once you spread it, there's like no redacting it.
Yeah.
I mean, I think we all agree that the world wasn't ready for this, but
Correct.
It goes to every country to realize that they're big boys and that they need to do what they need to do and not just start pointing fingers. And there are a couple of countries that have done it, right?
Correct. I agree. Yeah.
New Zealand also.
They did a really good job, though, to be honest, though. So did Japan. Japan's done a good job at it. Taiwan.
Vietnam has done a fantastic job.
Dude,
Vietnam
India
has been amazing.
India, man. You see,
India is not doing a good job.
No, but India, in the beginning, when they shut everything down, they were forcing people to shut down. They were spanking them in the streets.
They did. Look, Robert was asking me what percentage of the population in Korea has been tested. Only 3%. They only have tested 3%.
Only 3%.
But think about
but they've done a lot of contact.
Because the smart testing, right? Think about. Okay.
The right people testing, like you said. Going back to that, the right people testing.
The right people, right? Think about a video game, right? Like kind of like those alien shooting video games.
Yep.
Right. Imagine that you're there like aliens, right? You shoot your bullets, and let's say that in the map there are some aliens that spawn other aliens, right? What Korea does is they look at those and shoot those so that you cannot generate more. What the United States is doing trying to, try crazy going. And we have tested 17% of our population. Obviously, it's not the highest one.
But you're testing blindly, though. I mean, there should be more rules on testing who should be tested. That's the thing. And this will help.
It's also like a lot of the people they like choose to test. So the people who are worried enough to get tested probably aren't the people that need to be tested.
Yeah. Right, exactly. Or you could take the approach that United Arab Emirates do, where they said 51% of our population gets tested. Okay, you win. We can't watch it like this, okay?
But at least they can actually physically do it and provide the results on time, though. That's the difference, though. You understand that? Yeah,
they have to have itinerary. They have to be ready for this. And again, we were not ready for this, right? If the pandemic was about buying pickup trucks, maybe we will have
we were so good at it.
I know.
Well, part of the issue is that also too is because we rely on other countries to make our testing kits for us and making our own, even the mask or anything like that. Or we rely on other countries to make massive. The supply chain issue, we just find a big hole in this.
Again, it's our fault. It's our fault.
Correct, because we wanted cheap, fast stuff, right? And we had to rely on other countries. You're right. But we started realizing that more and more, and that whole gap, the supply chain, is now super more visible now. But how do you think we're gonna learn our lesson, though? That's the biggest question.
So one thing you can look in history is that human beings are particularly amazing at forgetting their own history.
Oh yeah.
We are like so good at it as a general, right? With its exceptions, but we haven't learned a lesson. And think about the States, right? Because everybody's like, oh my God, but the States are so big, 330 million people, right? Sure. But we're divided in the states, right? Mm-hmm. And we have a lot of small states that are not doing well. And it's like, okay, prove it, right? Like Emirates, United Arab Emirates has almost 10 million people.
Yep.
How many 10 million people states have not been able to get their stuff together? So, it's very sad. Again, it's cute. It's cute that the states think we're going to do it. So the real question is what's going to happen, right? And there is no stop to this. I mean, it's science. It's going to keep spreading, and it's going to keep burning every tree alive until either we get a vaccine or it burns the whole forest. That's the two outcomes.
I mean, I feel like if we had the leadership who cared enough to like try to stop the next one, it would be fine. Korea also had this. The reason that Korea is doing so well is that they had a pandemic. What is it, like 2 or 3 years ago?
Correct. They're more prepared. Asia in general.
So since that one, they've been much more vigilant on it.
It's the same thing for China, right? It's not the first rodeo for them. It's not the same thing for. It's the same thing for. It's in Vietnam. Had a similar situation before in the past too as well. So,
Yeah.
So,
But I really don't have any sympathy for the States. I mean, we knew what was happening, right?
oh, we watched it. We laughed at it.
Right. So
I completely agree though. Like, so I mean, like, so now, you know, knowing that obviously the testing is behind, right? There's a lot of different reports I've seen out there that people think the accuracy of test data is not even accurate either. Even the FDA, they said that they're not confident. There's a few articles out there they said that they're not confident in some of these testing kits. Like, so for me, even, you know, like our own own government, I guess, agencies saying that kind of stuff for me is very already like another red flag. And you're right. I mean, listen, this is not gonna stop. And so what do you think that they could do to improve on it? I mean, obviously, like, I don't think moving the data results from the CDC to the HHS in the health department in the White House, that would help. You make it the data faster, who cares? But at the end of the day, that's not really helping your data, right? You know what I'm saying? Like, you moving one source to another source.
I think we need a federal directed plan, like something that says this is what the country is going to do, right? This is how we're going to contact trace. These are the people that we're going to isolate. The people that have to be isolated, this is how we're going to pay for them. This is how they're going to be able that they need money to pay their bills. But if you don't have a federal central plan
like a guidance
to stop this, we're going to burn every tree or race for a vaccine. It's either or. But I mean, look at Washington, right?
Yeah.
We probably won't get any new plan until January of next year. So
that's assuming that you have anything going. I mean, and that you drafted,
right?
But the thing is that though, I mean, okay. So for me, my biggest concern is like, okay, my career, my changed, right? I used to travel every single week. I don't travel anymore. I probably not going to travel probably the rest of the year until next year, July, if assuming that, you know, the infection has gone down. But in terms of, for me, like the ability to kind of like, testing can keep going for sure. But even with a federal guidance, do you think the states got to listen to that? See?
They have to, right? I mean, if there is federal money, the states will grab the money and go there. The moment the federal guidance, there's a federal guidance, it stops becoming a political thing, and then it starts becoming a health problem. So
a national thing, actually, health problem, yeah.
Right. Like, think about a hurricane, right? Like, we don't say hurricanes are false, right? So when they come through Florida and destroy Florida and Texas, we have a very standard operating procedure.
Correct.
That's
they could say national emergency, things like that.
Say national emergency, you move funds, you ask for federal money, you send the National Guard, you go to troops, you put people in the stadiums. It's ugly, but it works. Like, we know that we can take hurricanes and we know how to do it, right? Because there is a plan and it's not politicized. So,
I mean, we had a federal guidance. We were in national emergency right now, though. I mean, still in national emergency. You saw how it goes.
we were in national emergencies for things that should not be in emergency. So I feel like if we don't have new leadership on January 20, we're going all the way until we get a vaccine. And it's not only about like, oh, now we have a vaccine. It's now we have to mass produce this vaccine. Remember, we're failing at mass producing tests, right?
I felt mass producing a lot of stuff, man.
Exactly.
No, don't worry, guys. We have Kodak. They're
Do you hear about
producing
that,
pharmaceuticals now.
Yeah.
So
dude, it's crazy. The stocks, it's so nuts.
But it's good for them. Their stock went to heaven. So
it's not a topic to talk about, but.
To be honest, if we get new leadership on January 20, we still have to make sure that the leadership does the right thing, because it's not an easy thing as switching a flip. I mean, the world, the planet is struggling with it, and only with it. And very few nations are the ones that are actually being good at this. And I'm not trying to say that every government is incompetent, right?
Yeah.
But like, let's talk about Colombia. Colombia tried to do the right thing, right? They started with a strong quarantine that, really hard for them because of their economy. And then you had people that started doing underground parties. Think of like Prohibition era in the States, but like they would literally bust parties in Colombia every time.
Yep.
And it's
I heard about that. I heard about that. And they packed it up.
They packed it up, yeah. And then they said, okay. We're not breaking the law. Why are you not breaking the law? It's because we're only having parties, listen to this, with COVID positive patients.
All together, all over the place.
Yeah. So in order to come into a party, you have to bring your COVID exam as positive, and then you can come in. Because if we're already infected, well, might as well party, right?
There we go.
That is amazing. Oh my God.
Welcome to Colombia, people.
Wow.
Okay, listen. I cannot say the fact that's actually pretty smart, but
that is pretty smart. That's a pretty good reasoning right there.
How clever is that? How that shows the reliance, the resilience of Colombian people to party, right?
Yeah. You walk in for work with a shot aguardiente, just say, you sick already.
Yeah. So obviously it's a genius thing until you actually think about it, because how do you get there? Where do they buy the stuff? You have people that are positive, not freaking quarantine.
Correct.
So, and then the biggest mistake that the country did, one mistake, it just takes one. Look, the problem with this is that you need to be perfect or everything goes to crap.
Yeah.
Colombia did one mistake. They, for the first time in history, decided to create the day without tax, which you go and
the sales street tax thing,
like sales tax, yeah.
Yeah.
So for one day, anything you bought didn't have tax, and tax in Colombia is like double-digit percentage.
Yeah.
Is it count? Think of like a Black Friday.
Yeah.
Think people went crazy buying things after at the end of the quarantine.
That's crazy.
Why did they do the tax-free thing? What was that supposed to do?
To help the economy, probably.
Yeah, reanimate the economy.
Yeah. I mean, think about it, right? So back to school day in the United States, anything the school you didn't buy, you didn't get taxed for 2 weeks straight, right? Mm-hmm. But they did that all one day and you're right. And sales tax in Colombia is huge. So for them, it's like an incentive to kind of buy stuff. But people went out to the mall, I'm guessing, or the little mom pop up businesses. Like
everywhere. Like my family was sending me footage because they didn't go. And it was like, think of Black Friday and like Walmart, like people back to it. It's a mess. So after that, cases start going up. And
wait, was it because everybody was going out? It was like
So wait, did the shutdown stopped? What happened to the shutdown?
So the day without tax was at the end of the shutdown. They had to stop the shutdown because the economy couldn't handle it anymore.
Oh,
shit. People didn't here's the problem with developed nations and developing nations, right? In the States, sure, people freak out. Oh my God, I'm not gonna be able to pay rent, but let me go to Publix and put things on my credit card, right? In Colombia, there are no credit cards, right? Yeah. So it's like, oh, I cannot buy bread. Like, how am I gonna eat? So the government has to do like food trucks, which to be fair, in the States, they also have it. Yeah.
We have food centers here. We have food centers here to pick up food, things like that. And there's food stamps too, also to help out. But in Colombia, it's a little bit different. Also, keep in mind, a lot of the Colombian debt is in dollars right now too. But that's a whole different topic we can talk about. But you're right. They couldn't handle the shutdown in a sense, right? I mean, it's the same thing happened in Peru too. In Peru, right now it's winter down there. And one of the biggest issues is that they're facing huge economic issue. And that's part of the same. And so now Colombia is open right now, right? In a sense, or like, are they at least trying to do the right thing by telling people, hey, wear a mask, be safe, things like that? Like, are they doing that at least?
No.
No.
No, they didn't. And I was actually talking to my sister today, but I was like, hey, how's people doing, blah, blah. And they're like, no, people just don't care. People just don't care. Obviously, there is, I don't want to speak for 100% of the people, because the Colombians watching this that are taking this thing seriously will be offended. Yeah. But the reality is, again, that this is everybody's in it or it doesn't work. Correct. So if you have a 20-30% of the population that don't pay attention, it all goes downhill. So she was standing like in her apartment, like she's taking it very seriously, but she like looks out the window and there are people partying every day. And like,
so is it because, do you think like the whole quarantine happened so long, the mental fatigue behind it, and like, they're like just so sick of it? They're like, okay, you know what, we can't, I mean, this is all happening. I'd rather die working than not be starting from death, feeding my family, things like that. You feel like, I mean, obviously a lot of things adds up very quickly. I mean, I can see
something very similar is happening in the U.S. too. Like, like in San Francisco, we quarantined for months, and like at this point, everyone's tired. Like everyone just wants to go outside and go back to normal.
Yeah, Again, and yeah, I mean, we are a generation. I mean, there have been multiple generations that we never had to face anything like this, right?
That's true.
So we don't know how to act. We don't know.
We don't know any better.
Right. Exactly. You have to give the benefit of the doubt, right? Like, we don't understand that this is real and that this could, destroy the way we live. So we don't want to accept it. We want to fight it. We want to say, but why me? Why my,
why my freedom?
why my graduation? Why my freedom? Right. Whatever it is, right? Like,
yeah.
Why lifetime? So, but I mean, these things happen. And the more humans we have on the planet, the more it's going to happen.
So before we divert too far, going back to the whole data situation, okay, so we know that the data is a little bit behind, right? And we know that for a fact that now that testing is still a bit behind still. And obviously, as we keep ramping up testing, I just feel like, do you think like now, as the White House announced, hey, we're going to take the data from the hospital, then the CDC handling it. Do you think that was a good move?
No.
Why is it that?
Because regardless, I'm not trying to answer this without any political
no, I'm not. I mean,
point of view. Yeah. But think about it this way, right? You are in the middle of your most important product launching, right? You've been using this software or this system for something. Yeah. And in the middle of the game, you say, okay, you know what? Scratch it. Let's start over, right? I used to work on these robotics competitions in college where there was these autonomous submarines that had to do tasks, right? And every run, we had to tweak the code a little bit and we ran it. I cannot imagine somebody in the team saying, you know what, let's start over.
Let's redesign this.
It's not really start over. It's more like, oh, let's get a new team to work on it.
Yeah, that's what it is. In the middle. It is. Yeah,
that's what it is. Like, we're going to take this team, we're going to stop them, and then we're bringing a whole brand new team and just have them relearn everything, redo everything again.
So regardless of anything else, let's put aside all of the other reasons.
Correct.
We just don't do that. Yeah. We just don't try to restart the game in the middle of the game. Yeah. The game.
But what was the reasoning behind doing it? What did they say was the reasoning?
They said that because they were not reporting data on time. They were lagging. They're 7 to 10 days behind. And so for me, my biggest issue, also it's not a political thing, is for me, the biggest issue is transparency because the HHS, the health department database is not public. So for people to get public data, you need to have access to that database. And then for doing research, to do any kind of, just to have the transparency. Right now, the lack of transparency is already killing us. Even more lack of transparency is going to create more, more kind of insecurity, more sense of insecurity in the sense with that data, right? And you're not going to believe it because everything's being covered up. And I feel like that this kind of time, I think the more transparency, the better there is. And right now, I think we're going the opposite route.
Well, how does bringing it to the government to hold the data be more transparent?
Because they have a bigger team, supposedly, the HSS department, youth department. And
but you could have said send that to both.
Yeah. Or you could have just been
send it to both. That's what I'm saying. Yeah.
CDC, just open up your data. That's all.
Not only that, they could send it to both. You're right. I agree.
And they're sending emails, right? So it's hey, can you copy me in the email? That's
CC everything.
Well, I'm serious. That's all it is. So no, I agree. It definitely creates some questions and some skepticism. The fact that you're moving this instead of just adding. Look, if they said, hey, we're going to send this data to 5 more agencies, people will be like,
we wouldn't have this talk. You and I wouldn't have this talk right now. I agree.
Right. So again,
the problem is there's less trust in the government than the CDC. So I wouldn't trust having the government hold that data over the CDC giving us data.
That's true. Yeah, I can see that though. But also,
go ahead.
Well, with CDC parsing data, though, they, obviously, a lot of the funds has been cut, so their team was not ready for the pandemic. You can tell, right?
Yeah.
The way they reacted, the way the sites being reported, things like that. For them to process all that stuff, the team was definitely not ready. And if you look at the last 3-year trend, the amount of funding to CDC it's been gone down. And I mean, whether it was for pandemic or not, obviously it was for probably different reasons, but I just think that they were not ready. And I think that this exposed us of, our playbook for pandemic either. Even a playbook for pandemic that was designed years ago, it's definitely not ready. it's at the end of the day, comes back down to is who executes it. And even if you have the perfect playbook, if you're not execute with the right people, with the right competency to executing that playbook, it's useless. It's garbage.
Yeah.
It's rough. It's frustrating.
Not prepared. We're not prepared. I mean, look, listen. I mean, to be fair, so many countries are not prepared. We're not better than India. We're not better than Brazil. We're not better than Colombia. That's the crude reality that our superpower has to like wake up to.
Yeah. Well, okay, now because now we're not prepared with infecting everybody. Now, do you think other countries are gonna let us in eventually?
The other countries are what?
Are gonna let us in to their countries?
Well, did you see that map that was released recently of the countries that Americans can fly to?
No, I haven't seen it.
It's like Croatia, and that's it.
It's like,
wait, is it really? Hang on, let me find
like
it.
It's Turkey, Croatia.
Countries that allow Americans in. Hang on.
It's like
I know a bunch of people who have bought tickets to Croatia because they're like, that's the only place we can travel to.
Croatia's amazing. I love Croatia. Hang on, where's this map at? Hang on, let me see. Oh yeah, I see that.
Yeah, I think I started seeing it.
New York Times. I found this New York Times.
Oh yeah, you go. Yeah, so that's the answer to your question. Yeah, our global position has already, like the blue passport already is so weak.
I guess having dual citizenship might help, right? So.
Yeah. So I mean, but at the end of the day, look. At the end of the day, this disease, it's a good opportunity for countries to learn how to do this right for the next one, because there will be a next one. And
yeah, that's true.
Not for the same one. And look, this particular COVID-19 really hit us hard because of their incubation period, right? The ability of having 14 days in your body and you don't know about it really allowed to the spread. And obviously is way more fatal than other family of virus. But if we get another one that has a similar incubation and infection rate, but a little more little,
we're screwed.
Then, I mean,
but also people, the fact, okay, so the fact is that most of this stuff, if every single virus, things like that in the beginning, just a very unknown, right? And because of the unknown, people started adding opinions instead of facts. And then that becomes a fact, and then it just spread really fast, especially through social media. And then you realize people are talking just shit, and you don't know, they don't really have a true source. And so that was the issue with this. I feel like people made facts, their opinion as facts, and that's what happened in a sense, and they downplayed it. And because of lack of leadership, kind of proving that, that situation, hey, this is a serious thing. We need to have a sense of guidance from federal level. Let's gotta handle it, right? So, I mean, even now, even with United Emirates saying allowing people to travel, it just said that, hey, if you landed within 96 hours and you make sure you still have negative results, and if you don't have any results, you better be quarantined for 14 days regardless. And if you find out you break the quarantine, if you break the quarantine, it's a fine of $27,000. So let me tell you, you don't want to be fined $27,000. So you better stay quarantined for at least those time before you even get there. I think that kind of harsh mentality, it shows a proof of seriousness of this situation, right? And at the end of the day, it comes back to our individualism. I think, Robert and I, we talked about this in the last podcast, individualism versus actual, our sense of community, right? What is the best for everybody else, such as for myself? I think culture has to play with this a little bit too as well, if you think about it. Mm-hmm. But if all we did a part, though, and we have a sense of leadership, it has to be the perfect combination. Sense of federal government helping providing guidance, people actually caring, the media actually portraying the right things, in a sense. And I think it has to be a little bit of both. It can't just be all one-sided. That's what
but like Luis said, if the government showed leadership and made some mandate, I feel like it would trickle down into the states having forcing people to do stuff, and it would push people. It would change their mindset rather than just being like, oh, everything's fine, and then every single state has to individually be like, okay, do this, or okay, do that, and then people cross state lines all the time. So it's hard to control anything.
Yeah.
No, yeah. I mean, the government does have a lot of influence. And again, look, it's something that maybe we don't like to accept. But look, this is before our time. But one of the big problems that this country, United States had back in the day was drunk driving, right?
Yeah, seatbelts. Don't forget about seatbelts. Yeah.
Seatbelts. So there was a federal direction that this is what we're going to do that trickled down to the governor. Sure, there was a little bit of push here and there, but a generation later, we wear our seatbelt. Like, it's automatic.
There was also advertising on it too as well. It would enforce the law. There was a whole, like, you get fined if you don't wear seatbelt, things like that. Yeah. So, I mean, do you think there should be a law of forcing people wearing masks right now, see?
Yes, 100%.
You know, and if you don't wear a mask,
there shouldn't be any controversy about it.
There shouldn't be people that are like arguing against it. Like,
right.
what does it hurt? Like, what does it hurt? Might as well just do it.
Yeah, and
there is a law. There is a law that we have to wear clothes on outside. Don't see people fighting.
Yeah.
Oh, there was a restaurant here in the Bay that put up a sign that said, if you don't wear a mask, we're not going to serve you. And then now people are suing them.
How can you sue them? It's their restaurant, it's own business. I'm getting.
Yeah, I thought if it's your business, you can choose who you want, but apparently it's some sort of discrimination thing that they were saying, and so now they're being sued. They may have to go out of business. Yeah, isn't that crazy? They said you need to wear a mask, and somebody came up and was like, "There's discrimination here," and then now they're like the government is like coming down on them. The San Francisco.
I mean, if you're a local judge and you see that case, you would throw the shit out. That's all I'm saying.
I mean, I hope so. It just seems so ridiculous.
Well, the amount of time and money and frustration you have to go through just for that case.
But to be fair, you needed a government man. No. I mean, I agree. It's ridiculous. But some other states, the governor said it's mandatory that you wear a mask in public business, like they did in New York, and that's it. It becomes legal. The whole thing, it's so... Anyways, look.
Well, people now in New York are almost like people are out there eating out in the streets and stuff like that, just because at least they have the outdoor sitting situation, which is nice. At least you guys get to enjoy the summer there now, you know. But still, I mean, things are opening back up for you guys out there, but you still have your cases still.
There are still cases, and there was a tweet by let me put it here, by the governor Cuomo today that made me laugh so much. Let me see, I'll find it.
Yes, send it to the chat so we can post it.
Yeah. But okay, let me see if I get it quickly. Okay, so it says it's Saturday night, party like it's Monday, or like you have a big exam tomorrow, or like you have a 6 a.m. wake up call. Besmart.
So pretty much,
you're breaking up for me a little bit.
So end your party early, pretty much. So Robert, he sent it the tweet over here. That's pretty funny.
Okay. All right. Yeah. Let me show this.
So don't black out. Go to bed early.
Saturday night. Party like it's Monday, or like you have a big exam tomorrow, or like you have a 6 a.m. wake up call. Be smart. Be safe. That's funny.
Kind of like saying, hey, just because you can go out now, don't go crazy. But this is the kind of messages that leadership sends, and then people in New York really take it seriously, right?
That's true. He has one sense of direction.
Hold on a second. I am losing you guys, I think. Hey guys, Robert in post. The audio in my headphones went out, but the audio on the video seems like it's fine. So not sure what happened there. Sorry, technical difficulties. All right. Yeah, let's take this time to segue. All right.
Yeah.
And go into our extra MSG section.
You want to start? You want to kick it off, Luis? You have something to share?
What is the name of the section? Extra MSG?
Yep.
Yeah.
And then I was gonna talk about the toilets here, but since it's extra MSG, while I'm locked down here, I've been spending a lot of time looking at YouTube videos, and there is this comedian that is making this new segment called Uncle Roger.
Yeah. I know he's talking about.
Let me leave and come back in. That's what we're gonna do.
Yeah, he's on TikTok. I know exactly what he's talking about.
No, it's on YouTube. I'll put it here.
No, the guy's on TikTok too, though. And he posts this video on TikTok. Yeah. I actually follow him. He's an Asian comedian. He was talking about the rice thing too. Like.
Yeah, egg fried rice. It's so funny. It's so funny. I'll paste the link right
Yeah. So hang on. Let Robert join back.
Hold
Share
on.
the link.
Yeah, it's a. I thought that was hilarious. It was just really, really, really funny.
All
Is
right,
it the
guys.
BBC one?
I'm gonna leave and come back into this meeting and see
Okay, go
if
ahead.
that
Go
fixes
ahead.
it. Again, technical difficulties. Sorry about that. Now back to the show.
But yeah, it reminds me because the MSG, because he's like, if you're happy, put MSG. If you're sad, put more MSG.
Yeah.
Because if you're getting married, put MSG.
The reason why we call it extra MSG is a little spice to the what's called podcast. That's which is
Yeah.
All right, Robert, you're back. I see you here.
I'm back. I'm going to somehow
No camera.
your videos switched.
Well, your camera because you joined back. That's why.
Oh, that's right. My camera's on. Okay.
Yeah. You'll have to.
All right.
You have to switch the videos probably.
I know. So your video, your two videos switched. All right, I switched it back. All right,
All right. You good?
I'm good now. All right. So what was our?
So in the chat, Luis posted a link for the Uncle Rogers video.
Yeah.
Oh, Uncle Roger, the rice video.
Yeah.
Yeah. So
All right.
I was saying that in the video. Yeah.
Drain it.
Let's. We're gonna.
Yeah. So for people who
What
hasn't
you
seen this video, it's pretty much
Drain the. Oh my
Uncle
God!
Rogers
You're
kind of
killing
like
me, woman.
disguising,
Hiya,
not
drain
disguising, kind of pretty much narrating of and providing his commented thoughts about this BBC video of them how they're
Drain
cooking
it.
the extra rice,
What you
and it
doing?
talks about it's
What
literally
you
like
doing?
them talking about the washing the rice, things like that, all the way through the steps. But you want to play the video, or
Yeah, let's
actually
start- let's
it's,
start at
it's
0.
7 minutes though. It's 7 minutes though, so just we'll play a second
Oh,
of it.
all right. We'll play a little bit of it. We'll see.
Yeah.
All right. Let's go.
Drain it.
Drain
What you
it.
doing? What you doing? Drain the. Oh my
Draining
God!
rice.
You're killing me, woman. Hiya, drain the. She.
The rice.
She draining rice with colander. Hi. Hello, my name is Uncle.
Really simple.
This is pretty
It's
good, though.
cheap.
Where
it's
does
delicious,
it
really
start where
satisfying.
she
Nice.
So if
Don't
you
be
fast
afraid.
forward to like a minute 45 seconds,
Go
she
on.
talks about how take a cup,
Why you
of
measure
water, add
water
it
with
add it
cup?
to the rice,
Just use
and then he's like,
finger,
you don't need
you
to
put
measure the
rice
rice.
with
You
water.
don't
That's
need to
right.
water.
Just use your
Use
finger.
then
Just go up to
Just
the.
Yeah.
just use your finger. So this whole video, he just talks about
Joe, it's
how
gonna be
Asian
good.
people do it,
Enough
and that's
rice
true to
for
be honest. That's how I do my.
Also,
my
like,
Now the rice is
like
on.
you don't have to do all this. A rice cooker is so easy.
yeah. Well, the thing is that though, did you see how she drained the rice
Don't
though?
wash the rice.
Oh my God, yeah.
So honey, so
Yeah.
numerous.
So
That's-
Get that onto
yeah,
a medium
she
heat.
reacts really
You can
hilariously
just
to
add a
it,
little
but
bit
at
of
the
oil.
end, like, oh, I don't like this rice. Looks too healthy.
Sit around.
It
And
does
then
look
he's
too
like,
healthy.
Yeah.
Then
And then he goes,
the rice.
you need to
This
put
is-
MSG.
oh,
If you're sad, put MSG. If you're happy, put more MSG. If you
That's
are
good.
getting
That's
married,
good.
Put MSG. It's pretty good. Pretty good. So
That's
that
that
is
is
awesome.
exactly what you gotta do. If you want it to taste good, you just put extra MSG on. That's why we
A little
named this
spice.
section that.
A little
Just
spice, that
Add a
helps
little
a lot.
spice, add a little seasoning. It's it's funny
Alright.
that like she like drained the rice and then poured cold water over it as well.
Yeah.
What, like
It makes no sense to me at all.
like really, what was the point of this?
Yeah. All right. So we've talked about COVID related. I was going through Reddit, and then I found this, and this guy designs fake products, right? And so pretty much he designed a finger.
He designed a finger.
Yeah.
Alright.
So if for those who are not watching this, but it's pretty much this guy. He developed this finger in a lipstick bottle, and what he does is kind of does a little advertising and showcase that he doesn't want to have germs in his fingers. So he pretty much replicated his finger, and he just uses different scenarios.
All right.
That is
Let's
hilarious.
start this. Let's see this
Yeah.
commercial.
Yep. It's 30 seconds long. It's not too bad.
Basically, it's a finger in a to use your phone. Okay. Across the street. Wait, he pushed that button and it didn't it didn't do anything. So it didn't really simulate the finger.
That is hilarious.
He picked his finger.
Yeah. And he picks his nose and then stirs his cup with it.
This is really funny. This is really good. This is really good. It's pretty. It feels weird to watch it, but it's pretty nice.
Yeah. To be honest, I don't even know how you design a thing like that. Wait, what's yours, Robert?
All right, let me get mine. Here. So a couple of days ago, people sent me this. So people are going on Amazon and talking about they're buying these Haribo sugar-free gummies.
Wait, what's the point? What's the point of that?
Look at the reviews, right? The reviews are what makes this. Like the top positive review is Miss Rona is shaking in her boots. My friend hasn't been practicing social distancing during the pandemic, so I bought him a bag of these gummies for his birthday. It's now been 10 days since he left the house out of fear of pooping himself again. I'm going to say Haribo sugar-free classic gummies are the cure. I'm not going to say it's the cure, but it's certainly slowing down the spread.
I waited 89 pounds before I ate this, and now I'm a skeleton.
All of the reviews on this are hilarious. It's so funny. So apparently the sugar-free gummies, like, they make you
sick,
really bad diarrhea.
But some of them get a 5-star rating for it because they...
yeah, exactly. This is hilarious.
Buyer, be aware.
The horror at 30,000 feet. Wait, this is crazy.
Damn, that's super crazy, these reviews.
These reviews are so funny. These are like the funniest reviews I've seen. But it's just crazy. Ridiculous.
Wow. Apparently they really said make you go to the bathroom.
Yeah, apparently these really are bad. I don't know, one of my friends, she said that her friends ate some of these and it definitely like put them in the restaurant.
So her friend bought it.
So these are all true. Like, I think they ate it without knowing these reviews. Yeah. But yeah, apparently this is really bad.
That's crazy though. Oh my god. Alrighty. So segueing into obviously talking about COVID and some of the quarantine. So Alejo, you told us a little bit about your quarantine experience in Korea, but how's the quarantine experience in New York for you?
So the quarantine experience in New York was very, very different. First of all, because again, it wasn't really a quarantine. You were allowed to go out as much as you wanted. It was just a recommendation not to go out, but what they did is they closed everything. So there wasn't much to do outside other than going to the park or going for a walk or going to a supermarket. But the really eerie part of New York, it was that since I was in the city, everything is very condensed, right? And you hear ambulances all day long. So you were like working or sitting in the house, whatever, and they're very loud, right? And they're projected up. So if you're in a building, you just constant.
I live personally, but this
approaching to you and then going back out, and you're like, damn. And like, maybe we do hear, all of us, ambulances now and then.
Yeah.
But it was this constant reminder throughout the day that every hour you will hear another one and another one. And you were like, damn. And then whenever you went out, the city was empty. We're used to seeing the city so full, right? And there were the streets, there was nobody. And you just walked by yourself. And it was
How was grocery shopping there during quarantine time?
So it depends on the store that you went to. Yeah. If you went to Whole Foods, get ready for be there for hours. I never did that. A lot of people start using Instacart.
Yeah.
Just order the groceries that way. But like the big brand, Costco, all of these were just lots of lines. But people were scared. So people were like social distancing and, doing orders. So it was a little like that. At the beginning, everybody freaked out and like, you went to a shop and there wasn't like any meat or like, I don't know.
Did you have trouble buying toilet paper still?
Yeah. So toilet paper was a big problem at the beginning. And then people realized that, oh, wait, what are we doing?
It's not going to help.
Okay. Yeah, because like the thing is that after you buy your first 24 rolls, it's not going to go anywhere, right?
Yeah.
You need to buy another 24 in the
unless you eat the sugar-free gummies.
unless you hit
Yes.
the gummy bear. So what happened? It was like definitely a spike of toilet papers, and then there was none, but then they refill it, and then people were like, well, people just can't stop buying because you don't consume it as fast.
Yeah.
But I feel like the supply chain was really good. There was food, there was everything in the city. That was never a problem.
So that's not a problem. I just want to ask you that. That's good
It
though.
was not a problem. That was definitely not a problem. So there were times that you were lucky and you had to just like make long lines and
Yeah.
particular items were out of stock, but nothing to resemble any type of crisis really, right? The hand sanitizers, that one was hard to get.
Yeah.
And the disinfectant wipes,
The Clorox wipes were
The
like,
Clorox wipes. Yeah.
to the time I left, it was still a problem.
Yeah.
Like,
Lysol. Things like that.
literally, they would literally arrive at store and people would just buy as much as they can. They had to like limit it per customer or whatever. But yeah, those two were a problem. But other than that, it was fine. The big problem in New York obviously was that seeing the city like that was really sad. Like all empty, everything closed. So many businesses had to have closed. There are websites dedicated to the New York City businesses that are closing. And
Well, the small, literally the small mom pop businesses there. That's the sad part about it. You know?
yeah, it's a big problem. Like my CrossFit gym closed. Like
Really?
and my friends' CrossFit gym also closed. I don't know how many gyms are going to be alive at the end of this.
Yeah, that's what I say. Like, so they're not going to reopen it. I know a lot of gyms have furloughed their employees, obviously, but at least they're furloughing it and they will open back up. But I mean, I guess if you cannot pay rent, how do you open back up, right?
Right, exactly. The big problem there is rent. So commercial rent will eat you up easily.
Oh, I think the commercial industry is done for because of Corona. A lot of offices are probably going to. A lot of companies are probably downsize the offices because a lot of people realize they can work from home.
It will definitely not be the same for maybe never. You're right.
Yeah,
I had the same feeling in San Francisco because I live right downtown in like where all of the businesses are and stuff. And just like you said, usually you see so many people walking around and it's just so dead. Everything just is it's very sad to see, even though there wasn't really too much of a problem with getting anything, groceries or anything like that.
Really? So before I left LA, I purposely bought a bunch of stuff like before the shutdown even happened. So I ordered a bunch of Costco stuff, stocked it in my closet just in case I need to come back. And then I did the same thing before I landed to Orlando. I ordered a bunch of stuff from Costco to receive it there and just stocked it up just in case. So I didn't never had that issue. But when the quarantine happened, I had issue finding stuff. So I said, you know what? I stopped going to Publix. I went to Asian markets more because I never had an issue to go to Asian markets to find veggies or to find any yeast was hard to find to make bread, things like that, or even sugar was hard to find. Rice was hard to find.
Damn.
But if you go to the Hispanic stores or an Asian market, it was always full, and there was no line to wait there.
Yeah, I never had a problem getting anything like delivered, like restaurants still delivered, so I still got delivery every day.
Yeah.
And like Instacart was fine. It was just like little things like usually you would go get like coffee or something and you couldn't do that, like those type of things.
But you're right though. Like it wasn't really a quarantine because I was still running every day outside. But I didn't see much people, which is nice and stuff like that. I mean, but you can still see people walking here and there. But but at least people were more subconsciously aware about it. Hey, stay away from me in a sense. At least they were doing that instead of trying to kind of crowd it. I mean, obviously certain friends knows that they had some pre-existing condition or they live with their parents, things like that. So therefore they're like 10 times more careful. Yeah. So you got to respect that part about that. But you're right. The quarantine itself, it wasn't really a true quarantine like you're doing right now in Korea.
Luis, was there like an area in New York that like got a lot of foot traffic after quarantine? For like example, here in San Francisco along the water, it like nobody was in the streets, but along the water, there were people walking and tons of people there.
Yeah, they were, and there still are.
Was Central Park open for you guys?
Central Park was open, and that's one of them. Well, you will go to Central Park, and it was like packed with people. Every single park, to be honest, but Central Park obviously more. And then around the island, you have these running trails.
The borders, that's right.
Every New Yorker, or like let's just say 60% of New Yorkers decided that they want to become runners. So yeah, both running equipment sales went up, and those trails were packed with people.
It's hard to get weights. It's hard to
Dude,
get
the
weights.
weights, people were just selling weights on Craigslist for like $200 and people were buying them. Let me tell you.
You know
Like,
what's also like increased in prices is like microphones and like streaming cameras. Like people, like they'll be like on sale for $99 from the actual website, and then they're on Amazon resold for like $300. Like,
yeah. Polar bars, man. Polar bar. I still haven't gotten mine yet. Yeah. But I mean, you're right. I mean, I'm sure when you went to Houston, you probably saw the same thing. People were not really truly quarantined.
Oh no! That was another world. Cause like again, now that I'm here, I can compare to New York and be like, oh, New York wasn't as hard.
Yeah.
But when I arrived to Texas, it was like another planet. It's like, oh, good to know they don't have a pandemic going on here. This is great. Like, nothing, like everything was normal. Everything. Like
So when you flew in, right? Did they ask you to quarantine?
I drove.
Oh, you drove. So, oh, yeah, fine. When you drove in, did they ask you to quarantine? Because I know in Florida at I-10, they purposely blocked everyone down like that.
No, Texas, nothing.
Really, nothing.
Nothing.
They don't care,
That's
man.
good.
They don't care. It's funny actually that you went from one spot that was like exploding to the next. Like you went from New York to Houston.
Became looser and looser, like became less.
To Miami. Like it was
Then
like
you
all
went
the
to the
places.
country.
Are you sure it wasn't you that was like exploding?
Exactly. A lot of my friends are like, well, clearly the common denominator is you traveling to the
We're gonna be worried for Korea right now. That's what we're worried for.
So, the funniest thing is that one day before I flew, my girlfriend sent me a message being like, oh my God, look, Korea knows you're coming because they reported the most cases in months. That was, get ready, 113 cases. But
Wow.
that was the highest in like a lot of months. But they divide the cases in two categories: the community transmission and the imported. Like if I get
All
corona
the travels.
tomorrow,
Yeah.
like me, people like me. So if I get corona tomorrow, I will go into that category. The 113 was because they brought ton of military from around the world at once, and like 83 of them had corona. So that's why it was the highest one. But again, their community thing, like I think it was like 8 cases. Just
Well, the thing is that at least Florida started doing that kind of thing, tracking that kind of data. Before there were before, to be honest, not a lot of states were doing that kind of tracking, because one of the biggest thing was that I think going back to the data situation is that, okay, so how many didn't really truly travel? How many people were exposed to people? So if you look at this website that Florida has, and they actually have that kind of data now at least. And if you scroll down to the bottom of that, you can tell you, hey, how many people travel, how many people contact confirmed cases, how many cases still under investigation. If you think about it, there's 300,000 cases still under investigation over 480,000 cases.
wow.
It's freaking crazy. That means there's so much unknown, And if you scroll down though, like, a part of this wasn't there before. And I think the site just went up maybe a month ago, maybe even. And one of the biggest things, the way they were reporting death in the beginning, it was because CDC had a code, referral from the WHO, and if it's 7.1, guaranteed COVID death. If it's 7.2, it's probable but inconclusive, but still could be related to COVID death, right? And the way they summed up the cases of death, they added those two numbers together. For me, that kind of was a little bit weird, because even though they weren't sure, they just added total tally up. But that discrepancy slowly decreased as they start finding out more stuff, as they're starting doing investigation. So obviously you can tell that today's day, if they report, there should be a minimum of 7.2 cases, but if that's not the case though.
Yeah, this sucks.
Yeah. So 300,000, man. You see that? This is Florida alone. But not every state has this kind of data.
300. Where are you getting 300? I see 400,000.
There are 474,000, yeah.
Yeah. But if you look at the 315,000
under investigation.
Yeah, total over.
Yeah, so that's basically all the people that are waiting for the results.
Yeah.
Isn't that crazy?
That is crazy.
They have 300,000 people waiting for results.
In a sense, That's what it is.
Yeah,
Positive
that's basically
cases
the
by.
investigation.
Oh no, this is they're investigating how they got it.
How they got it, correct. How they got it, though.
So they got it, but they don't know how they got it.
Yeah.
I see.
It's
So
like,
like contact tracing, basically.
Yeah.
but I mean, at least, again, this website literally was up maybe a month ago. This kind of data did not exist. But I'm sure in other countries, smart countries, that was the first thing. It's the right people, you know what I mean? Like you said, how do you target the right people to get to test? This comes back to that statement.
I'm sure they only tested 3% here. That blew my mind. I thought it was going to be way higher.
I thought it was going to be higher too.
Incredible. That like when you look at it, like, you know how I told you in the watch, I was doing rankings, right?
Yeah.
Korea at a point was number 2 in the world, right? They're down to number 74. They have total, this is just so shameful for the rest of people. The total number of cases is 14,336.
Jesus.
And they have had 301 deaths.
Oh my God, man. All right. I mean, listen. Obviously, this is frustrating. So let's lead away to our venting session. So, Luis, you want to go first?
You want to go from depressing to venting?
Might as well. I mean, might as well, right? We already have this feeling.
I thought we were not venting yet. I've been venting the whole time. Okay. Here's my venting session. It really upsets me that I'm not upset with the people that votes Democrat, Independent, or Republican, right? Mm-hmm. They're voting, they're doing their duty. But what really, really kills me is the people that just don't vote. I wrote this article 2 years ago, I think 2 years ago, about that. And it's so incredible. Like, just think about this. You have 300 million people that can vote, or 200 million, whatever it is, right? That are eligible voters.
Yep.
You have over 40% of those that haven't registered to vote, right? This is filling a paperwork. This is the government knows who you are. Why are they not automatically registered to vote? Like, the fact that we cannot even register our citizens for voting once. I registered to vote once, and it's the same registration, right? For like,
you know, other countries automatically register all the citizens to vote, right? Some of the countries, yeah.
So
I registered in Florida and came over here. I don't think there was anything that I had to do other than get a new license to get to like re-register.
Right.
Right.
Exactly. So just think about it. Like, fine, the government doesn't want to do it automatically, whatever. But like, we have to. It's like it's not even a moving target. It's like literally a project 101. It's like there are databases and databases of people that we know who they are, and it's just like, can you please register and give a damn?
Do you think because they don't care?
I think they don't care. I think it's simply because look, in the biggest scheme of things, these 40% people, or people, they don't really get affected by the government directly. You know, you have a job, you have a family, you care about raising your kids, whatever.
Yeah.
Or you're younger and you just don't care, whatever. Like things like this, pandemics like this have to happen for us to realize that, the government plays an important role. Or after we get older, we naturally get it.
Yeah. It wakes you up, to be honest. It wakes you up.
It wakes you up, yeah. But a lot of people are also older that don't vote. So people just don't see a point. It's like, oh, I'm not subscribed to that channel, whatever. But
I mean, even I'm subscribed, and I don't know if my vote really counts. Like, that's the feeling you get when you vote.
But you're at least trying, though.
No, like, I do it just because, like, I feel like I should.
It's your duty. It's your duty.
But really, even when I vote, I feel so small. It doesn't matter. But like, I really want to get to like, so where do we see, like, why is it that these people aren't registered? Is it like everyone I know is a registered voter? Like, I don't know what part of the population of this 40% of the population isn't.
We can
registered.
get in this topic to another podcast section.
I have no idea.
We can go.
So Robert, I uploaded because I'm locked down, so I'm doing a lot of videos. I uploaded this video called A World of Bubbles, where it goes into exactly what you're saying, where my entire bubble, 100% of my bubble, which is my world, everybody I know, to, like, what the hell, right? We're on this 40%, right? But it's because I don't know people that are not like me in these kind of like social aspects, right?
That's true.
If I grab a car and I drive into the middle of the country and start knocking on doors, those people live in such a different bubble than I do, that it will blow my mind everything that is normal or not normal for them. In their bubble, maybe, you know, those two always go to vote. No, they like politics and those things, you know, like it's crazy. And yes, of course, we all live in our own bubbles, and maybe some things are normal in ours, and this is one of them. But yeah, more than 40% of Americans that should be voting are not doing it. And I bet you that if they did, common sense will prevail.
But you think
it's not even like that's just people that aren't registered. Then there's people registered but don't vote.
No, don't vote.
Well.
Yeah.
There's a whole group of those people as well.
Hey, by the way, Alejo, share that video, you know, with the bubble thing. You know, I'm sure people will
send me the link, and then I'll put it in the description so people can go.
People will love to watch that, you know. All right, so Robert, what's your vent?
Oh, my vent? My vent is how so NBA restarted, right? And then Lou Williams went he had a family death, so he left the bubble and then went to like a funeral. Later on, that day, one of his friends, a rapper, decided to take a picture of him in a strip club.
What?
Right? So it showed that he wasn't in like I don't know.
A funeral.
I don't understand. Like I'm like he says that he went to the funeral, stopped at this place because he loves the wings there, and then went home. Which I think could possibly, like, they said like they have wings named after him, and he's like posted before about how good the wings are, right? So I'm just mad that his friend took a picture of him and posted it on social media.
Damn, ratted him out. His friend ratted him out.
I know his friend's like, oh, look who just popped by. Like, why would you do this? Like, this seems like such a bad idea altogether. Like, your friend is mourning, right? I don't know if he was or not. Probably he was. I feel like he was. But like, why would you even post this? I feel like if one of my friends did that, that would be it. Like, I'm done. Like, y'all are done. Mike, if you did that to me and like messed up, like now he has to be quarantined for 10 days and can't come back into the NBA bubble.
But do you think his friend did it to hurt him, or just because?
No, I think he was just like, oh, my buddy Lou Will's here, right?
Okay.
Like he was just like boasting that his friend was here or something. I don't even know why he did it. I feel like it wasn't malicious. I just feel like that's so stupid. Like, okay, listen, I'm so angry at him.
I get that if it's like you're in college and stuff like that, things happen like that, because at least for me, when I was in school, you know, we have stupid pictures online all the time, right? But I stopped doing that after college, in a sense, like posting my friend being drunk and stuff, just because this hurts.
He wasn't
everybody.
Even drunk. It's just a picture of him, and he's like, "Oh, look who pulled through," and then he tagged like the strip club.
Strip club.
But you know, your buddy is like, he's going into this bubble, and he left it because of this bad like thing that happened, and now you're posting of it. I feel like.
Oh my God!
Your bad decisions are not good for my life. I'd be mad at him. That guy.
That's crazy. All right. So for me, my frustration is that at least throughout the couple of weeks, I've seen more and more. You know, there's a lot of stuff going on happening, right? Besides the pandemic, there's a lot of things happening, such as the social movement. People out of jobs and things like that. And it's just for me, I hate this happening because it's more of people's like putting in a situation, hey, if you're not with me, you're against me type of deal. And I think there's less and less a lot of, like for example, wearing a mask, right? If you're not wearing a mask, sorry, there's gotta be, or even the other way around, like why do I have to wear a mask, right? Like in a sense, like, and just that kind of situation, that kind of frustration without even having a conversation for little things like that, understanding perspective, I think that's kind of dying down. I think it's creating a little bit more of a friction or hatred in a sense for a lot of things, like, versus, white versus everybody, wealthy versus, the poor, in a sense. And it puts everything into a category where for me, it shouldn't be like that, because life is not black and white like that sometimes. And I don't know, for me, like, I've seen that a lot more, like, especially with friends that I've seen around, where like, hey, okay, for me, so I'm very careful with the people I hang out with nowadays more, because people are just more sensitive for certain things. So for example, I care about other people's well-being. I do wear a mask, I go around, stuff like that. But let's say that I went to hang out with 4, 5, 6 people for a birthday thing. First thing I ask them, hey, one, do you guys all feel comfortable hanging out with each other? Do you guys know that you have no cases? At least have that. I do that homework, right? And they all said, yeah, no, I've been tested for this, blah, blah. I haven't hung out with anybody. And so at least I had that sense of trust. And obviously I show up with my mask and things like that, and everybody did the same thing. But there are situations where like that people don't even do that. And then they assume that, hey, listen, you gotta, if you're in this spot, you gotta do this, you gotta do this in order to do this. And I'm like, for me, part of it is that
be more specific there. Do this.
So for example, right? So I know a situation where a friend encountered and started hitting an argument. We're going to a restaurant where a buddy of him told him, hey, please wear a mask, in a sense, right? Mm-hmm. And then he says, like, to be honest, I tested negative and stuff like that, and then just us 3 here. And the other person said, listen, I don't care if you tested negative or not, I if you respect me, in a sense that you still gotta wear a mask, right? And part of it is that, listen, it's about comfort. If you truly respect somebody, it's about comfort, right? But then they start arguing about, if you're not with me, blah, blah, blah. Like, it became that kind of thing instead of actually truly understanding behind that. So the lack of compassion for a lot of the situation has disappeared. And for me, I think, at least personally, I've developed a little bit more compassion for the situation, and for the lack of maybe awareness, perhaps, that people may not have, but not everybody has done that. And part of the reason why, Robert, you and I talked about this in the podcast before, like, I think this whole point of this podcast to kind of have that kind of conversation as well, but to understand, like, we do live in a little bubble, right? Just to mention, we live in a little bubble. We don't know any better, but at the same time, though, how do we get people, to understand, hey, how do you develop that kind of awareness, that kind of compassion to break down that barrier? It's not black or white in a sense. You just gotta be able to have a kind of understanding, and I don't think people even, taking that into consideration. For me, I've seen them more and more now. Like, it's just. And it's affecting everyone's social life. And I think I just feel like I just wish people would take a step back, think about it first.
Do you think it's more as a result of everyone being quarantined and everyone's on edge, or is it more just
it's part of it too,
people
though?
Are just being more.
It's part of it too. Like, okay, you and I saw a video last week, of people, a guy hanging out free masks. They get mad for no reason.
Yeah.
Why is that? Like, that was like. Look, I'm not sure, Alejo, you saw this video before. So there's 2 guys holding a box in Huntington Beach, giving out free masks, and people just reacting to it like
yeah, they're like, if you want a mask, we have masks here. Like, we heard there's a shortage, so we have masks. And he's like, oh, do you guys want a mask? Like, you might not be able to have a mask, so we're gonna give it to you. And people, before they even like give them the option to have a mask or not, they're yelling at them, and they're like, why are you doing this? Cursing at them.
It has the divisions. I mean, look,
it is individual, right? And I respect that, right? But also, as an individual, you should respect others if you want to be respected, right?
I agree. I mean, I disagree with the guys yelling at the mask guys, right? Like, just say no and move on, right? If
you don't have to take it. They didn't even or maybe it was editing, but like they really what it looked like was they were like, hey, we have masks if you want one. And the guy's yelling at them. That's what it looks like.
Mike, the one thing that you're saying, not everything is black and white. I think that's obviously true. And United States having had this kind of very clear-cut black and white problems in a while, right? Mm-hmm. Let me give you an example, like Venezuela, right? If you come now and you say that you are pro-government, like, that just says so much about you. Like, do you really support the current government of Venezuela? Like, like where have you been, right?
Yeah,
I think that problem has come to a point that is black and white. You have to pick two bands that are completely orthogonal, not even orthogonal, opposites to each other, right? And there is no middle ground. There is no conversation. If you're part of the government, the other people are just going to hate you and vice versa. In the States, we had so many debates about so many things, about homeschooling versus this, versus private school versus public, that were very gray area, right?
Correct.
Right now, this whole people dying because of Corona is black and white, right?
Yeah, well, that's the issue. Yes, true.
Yeah. The social injustice that we have experienced is black and white, literally. It's black and white, right? So we have digressed. We have gone back in our progress in the States to more basic problems that developing nations have had to face and they're facing right now, right? And we don't know how to handle it because we didn't have it before. We're like, wait, but I thought my biggest problem is what is my football team, right?
Yeah.
So
well, our generation, like you said, our generation has never had that kind of stuff.
Nothing. We've been like spoiled brats.
Yeah.
And sure, we went through an economic collapse, but this is different. This is like
even during that, it was like at the beginning of our career, so like nothing. It didn't really affect us at all.
It did not impact us.
Right.
Our parents has gone through the war, like Vietnam War, all the crazy war, things like that.
Yeah, exactly. I mean, I have friends from Eastern Europe, right, and like pre-Soviet nations, and the way they see the world is so different than ours. Like every single problem, it's so like small, right? Because like their nations were destroyed in their lifetimes.
That's true.
They were born in countries that don't exist now.
They have real issues, you mean?
Exactly. And they always complain about Americans being like, it's okay. Like, you're all going to survive. Yeah. So anyways, I think the States, we have come back. Obviously we were post-World War II boost. We got to the top of the world. And I think this is a retraction. And we're really struggling with the idea that, guess what? You have to pick a band. And sure, it doesn't matter how open-minded you are. But if you decide to take the other band, I know why you're taking it. So you're not part of us. And I understand that it's frustrating, but it's not with everything, right? Like you can still go there.
For example, here I'll give you another example, right? So I have a friend who's pro-Trump to a certain degree for certain things, but he's a good person though, in general, like literally. But there are certain things that I don't agree with him. I don't judge him as a person, but it's a character for certain things. And he explains, why he thinks that way. At least that kind of conversation happens instead of prejudging somebody and just hating on somebody or something like that. In a sense that I think that lack of conversation, I think it's just slowly disappearing.
I think our politics also has a lot to do with it, where
that's true too.
It just gets more and more divisive. And then things like coronavirus, where it shouldn't be a divisive thing.
It shouldn't be divisive.
It's like it's very split. Like each side decided on a side and just like, oh, this is what our stance is, versus like, this is something we should all come together on, and like
you would think this would unite us a lot more, but it hasn't.
Yeah. No, I mean, I before us when we were kids.
Yeah.
Being on either side of the political parties was okay,
Yeah, it was okay, yeah.
So you had differences of opinion. You have things that were okay, were bad on each party.
Yep.
And the current administration has dedicated itself to really sow that discord, right? I mean, okay, let's go back. So
I don't think it was just this administration. I think it's been building up for many, many years now.
Yeah, let's go back. So you have Bush, right? You had that push to the right. So all of us go this way. And you have Obama, which is massive. Pull to the left. Yep. And then you got Trump, which is literally grabbing you and throwing you out the window on the right.
Yep.
So all of this back and forth keeps pulling the country apart. So it's not only about this administration, but it's about the fact that the ideologies have become more and more sharp, and the way this particular administration approaches things is very combative. It's very escalating things, right? It's
that's true.
that kid in the school that hits your lunch and then pushes you and expects a punch back so that he can like beat you up, right? Instead of like dialogue. So the standard operating procedure of this administration has been creating the division and comparative terms.
Do you think that was on purpose though?
I don't know. I haven't
It feels like it's on purpose. I feel like it feels
I haven't decided if he does things because he's legitimately
if he has any like purpose to his like thought.
I
don't
feel
know if he's
like
like thinking 4 steps ahead, or if it's just he's doing it and then that's the repercussions.
Well,
announcement.
Food? Is it food?
Let's see. I don't know.
아.
또한 방역을 위해서 문을 항상 닫아주시기 바랍니다. 감사합니다.
Thank you.
In English. Ventilate the rooms by opening the window
at least 3 times per day.
Remember to keep doors closed.
Keep doors closed.
Viruses and other kinds of diseases.
Even viruses and other kinds of diseases. Great. Now you're saying that in Mandarin.
That's awesome though, man. Man, if you were taking a nap though, I would be annoyed though. I was taking a nap.
But it wakes you up all the time.
Wait, what time is it there now?
11 a.m.
Oh, okay.
11 a.m.
So wait, how often this happens? Every 4 hours?
Maybe. I haven't timed it. But it happens all the time.
Damn. Wait, does happen middle of the night?
No. They let us.
Okay. Okay, that's good though. I was gonna say, man, if
the first announcement is always at 7 a.m.
Oh shit! So
7 a.m. Oh wow. That's killer.
Announcement for breakfast and for taking your garbage out. So.
Okay. At least, I mean, they do a good due diligence telling you at least, this kind of stuff though. To be honest.
Yeah. So, all right. So.
All right. Is it over?
I think
that's it, right?
That's it, right? All right, listen, we can keep going on about this whole administration thing. You're right. I think it's gonna come back. I mean, it is pulling us. I just think that hopefully, the next 4 years or whatever, even 8 years, right? Everything's come back to a little bit more central. Just because I think it's time to get united on the one thing. It's hard to see this apart. I guess that's for me. That's my bent. So.
Yeah, exactly.
We should have a COVID party. We start a COVID party to unite everyone.
Colombia. You think they're revolutionary at first, but then, that sounds genius. Yeah. When I hear about it, I'm like, genius. All right. Hey guys, thank you for having me here. This has been very delightful.
Appreciate it. Thanks
yeah,
for
we appreciate you coming on.
Especially you wake up so early in the morning to do that. So people can what can people subscribe to your watch list? I guess.
Pimp what you need.
Yeah.
So I send a link. All you have to do is put your email and then you're subscribed. And whenever you're done with it, there is a little unsubscribe on every email I send. But if you are still checking the numbers frantically, do this. It gives you peace of mind.
Yep.
Computer the numbers for you, and just send it to you. Whatever. I did it for myself, but then after the 5th friend asked me for it, I'm like, I'm making this automatic. So you just link, subscribe, and you start getting your emails from me. But it's nice. It's called The Watch.
There we go.
All right. Yeah, we'll put that in the description. So anyone who wants to can go and check it out.
So yeah, for anybody who wants to follow Luis Alejo, check out his IG. He's under the name. And for those who are listening, just also, by the way, Alejo is having every single day, he's actually kind of describing his quarantine dates as well on his YouTube. So follow his YouTube videos. So we'll post the link out as well.
Mm-hmm.
But until next time, everybody, thanks for listening and thanks for watching.
Yeah.
All right. Peace.
Take it easy.
Bye.
Thanks for joining us for this episode of the Gluten Free Organic Thoughts podcast. As always, we appreciate you. If you are watching us on YouTube, please don't forget to subscribe to our channel, like this episode, and leave us a comment. If you are listening to us, please leave us your honest review on your preferred podcast listening platform. And as always, you can find us on social media at Facebook, Instagram, and Twitter at GFOT Thoughts. Drop a comment and give us some feedback. We would love to hear from you. Until next time, see you then.